on the one hand, you may decide that it's not sufficiently interesting. On the other hand, these are these very topics which allow people to see that the changes are being implemented. And today we will discuss new sanitary regulations for kindergartens. And I'm happy to invite all those people who are involved in the design and implementation of these new standards.
Доброго дня.
Good afternoon. Today our press conference is devoted to new sanitary regulations for kindergartens. The National Reform Council assigned the Ministry of Health and the Ministry of Education to develop these standards. I'm Olena Zaplotynska, project manager from the National Council of Reforms. Access to preschool education had become very topical issue in Ukraine because in Ukraine we definitely feel a shortage of kindergartens, and there is obvious stagnation in the sector, and in general preschool education is not developing. That's why we decided to approach to this issue, reviewed the situation, and found out that the access to preschool education is a problem not just in Ukraine but everywhere in the world, everywhere in Europe, excuse me. And children from 0 to 3 months is for them preschool education is fully private, and from 3 to 6 years old this sector is funded by the state everywhere. Later, we approached to review of the sanitary regulations. In Scandinavian countries, by the way, they do not have medical regulations at all, which and up to 80% of children have access to this preschool education, and this proves that the less this sphere is regulated, the more efficient it works. Another important issue is employment of women in terms of gender equality. In Ukraine, the employment of women is at the level of 52%, while in Denmark, 84% of women are employed, women with children. Another aspect of promoting preschool education is the level of preparing children to school. Everywhere where there is access to preschool education, children are better prepared to school. I'm Tamara, Panasiuk, head of the preschool education department in the Ministry of Education and Science. I would like to point out the importance of this issue, which is part of the governmental program. And we believe that new version of the sanitary regulations will promote development of kindergartens, not just in the state sector, but also in private sector. Fortunately, the birth rate in Ukraine is growing, and more than 90,000 children remain in lines waiting for the placing for vacant position in kindergarten. And we believe that we should bring to the legal field those private kindergartens which are already open in private apartments. We decided to not just introduce new version of the sanitary regulations, but bring the licensing requirements in coordination with in accordance with these regulations. Ms. Lila Grinevich, Minister of Education, initiated amendments to the law on education in Ukraine. These amendments provide for private kindergartens to be established, also private-public partnerships in creating such kindergartens. Today, the Ministry of Education is working on amendments about corporate kindergartens, and we believe that this would allow to provide kindergartens for all children who need them. We are happy that the Ministry of Health appeared to be a very proactive partner in this work and heard the requirements of those parents who wish to bring their children to kindergartens. We believe that these new sanitary regulations will ensure the quality new legal field.
So the innovations for private and public institutions. So the organization of feeding, so catering for those institutions were not provided. That's why private kindergarten were not able to provide quality food for according to all norms of regulations. Also, there were no laundry facilities, and according to this regulation, they can service by public laundries if they do not provide services to health care institutions. There are also many other innovations, and this information will be provided by the chief sanitary doctor. Good afternoon, everyone. Good afternoon, representatives of mass media and the public. I would like to say that the adoption of the new sanitary regulations for kindergartens is a big step of our state towards Euro integration, and this is a bright example of good governance and regulation in the sphere of preschool education that is based on the principles of risk assessment and balancing the interests. And the previous speakers also stated that when we start this work, this document, we analyze the problems that exist, and the first is that the documents regulating the requirements to these institutions were from the times of the Soviet Union and were regulated, and they were concerned only with the public institutions. And now the problem is that there should be competitiveness in the market of preschool education, because business could not adhere to all the norms that were in the documents, these outdated documents. That's why public kindergartens monopolized the market. And you know that, of course, that those conditions in these institutions and the level of catering raises many questions. And there are some cases of poisoning because of low quality food. And we decided that only by clear regulation and development of the private sector we can provide our kids with quality preschool education without risk to their health. All Soviet documents that provided sanitary regulations were based on sanitary maximum, because you know that in the Soviet Union there was limited list of services and products that were provided to the public. That's why there were clear indicators as to the health and sanitary norms, and the state also provided information on the premises. And this was adhered to by all the bodies of power. And so there should be rationalism in this matter. And when we are speaking about the norms, what temperature should be, the type of insulation, and in order that our children were healthy, and in what way we can reach these requirements, is established now by the owner of this institution or the economic entity, if we are speaking about private form of ownership. So the moments I wanted to mention, and about which the discussion was carried out, about the broad circle of experts was involved in the development, the representatives of the Ministry of Education, the representative of Health Ministry, the public, representatives of professional associations, and we analyzed all the norms of the Soviet times, and we considered whether they should stay in the new document or we can provide these functions to the owner of the institution. So we established the categories of obligatory indicators that should be adhered to in order that the child felt good, and all other norms, they were placed in the category that is not obligatory, that is recommended, and the owners can decide by themselves about the color of wallpaper or linoleum or and other matters. And can you tell us about what is obligatory? So we removed that all those indicators that are not important. This is a document from doctor, pediatrician, or so when a child is absent for 3 days in kindergarten, in order that to get the access to the group, a child, his parents should address to the local doctor, to the pediatrician, and get the document that the child is healthy. And it is difficult and unpleasant, and when I brought my children to kindergarten, it took a lot of time to get these documents, and we understand that these were some speculations, because first you should go with a child to one place, then to another. And about positive moments, we removed the recommendations about taking the temperature, and also if there's no outbreak of some infectious disease in some settlement, or if it's not an epidemic period. So it is not necessary, because it takes a lot of time, and also the organization of catering. So there is a catering facility at the kindergarten, and now it is not really obligatory, because the catering services they can provide, catering companies can provide products to the to kindergartens, and also there is, of course, be the system of control, the system of assessment. This is called HASP, and there will be responsibility for this quality of these services. So the entity that is responsible will take all the the catering company will take responsibility, and this responsibility is removed from the head of this kindergarten, from the head of this institution. And in the nearest future, we will see that these lists, waiting lists, will be shorter, and children will get quality services in these kindergartens, and these facilities will be accessible to the public. And you know that people now pay in order to buy some equipment for kindergartens and for schools, and we hope that these changes will improve the level of services at the kindergarten institutions. So, good afternoon, dear friends. Prolisok Kindergarten Director Olena Danish. So, what can I say about this document and how it will be implemented in the capital? So, this is a new step in order to improve the matters in all the regions of our city. So, the document is simplified. Some sections are removed, and they made some references to other documents. This document is a recommendation, but there are some sections that are envisaged as obligatory by law. Also, they removed provisions on the clothing for kindergarten specialists, so they can polish their nails, they can do other things. So kindergarten should have these wonderful, well-dressed specialists. Of course, this is not good for a kitchen, but a person that takes care of children, they can have really good looks, and but of course they should be so there are also recommendations about the time to use interactive technologies for small children. So there should be time allocated for children when they can use smart desks and computer technologies. Also, they removed the ban on double.
І дійсно ці ліжка є не небезпечними. Все передбачено для використання.
So these So thank you, dear friends, and as a moderator, I would like to ask a question. Do they provide some norms about the number of children and groups? Because some double beds will be provided, and about the idea of corporate kindergartens idea. Are there going to be some tax breaks for these institutions, and do you have some ideas about it, and what the Ministry of Finance think about these ideas? So about the number of children and groups. Of course, it doesn't mean that the number of children will be increased, because by law on preschool education, it is said that in the groups there should be 20 children for preschool groups, and in nurseries there should be no more than 18 children. So of course the places in kindergarten are lacking, and sometimes there are more children, but when we developed this network of private kindergartens, we believe that everything will be done in accordance with the norms provided in legislation on kindergartens. As to second question about corporate kindergartens, draft law on changes to the law on preschool education and on corporate kindergartens has already been developed, and they introduced this provision to the plan of the government as to private kindergartens, and we believe that in the nearest future appropriate changes will be made, and the provision of the corporate kindergarten will be adopted right after the changes will be introduced in the preschool education legislation. And it is envisaged by Constitution free of charge education for children, including of preschool age. It is envisaged also private, state and private partnerships, and we say that money goes after a child, so the state should provide for children, and that will be made within the framework of public and private partnership, and that will be to the benefit of children and parents, and part of the money will be provided by the state and part by parents. So this is a reality that now in the world, in the sphere. So, Kovtoniuk, Ukraine TV channel.
I would ask Svyatoslav Viktorovich, would you please develop more on some issues? Of course, liberalization of the regulations for kindergartens is good, but many parents today nevertheless trust to the existing sanitary regulations. Whether you won't lose control over the situation, and what in case of any accidents in the kindergartens from sanitary point of view, for what satisfaction could parents look for? Thank you for this question. In line with the legislation, the head of the legal entity, the owner, or the manager, general manager of an institution should bear total responsibility, not the state. parents are responsible for the health condition of a child before they transfer this child to the preschool educational institution, to the kindergarten. In the period when a child remains in the kindergarten, the health of the child is responsibility of the managers and staff of this institution. In case of any trouble with the health of a child, an expert should be involved, and this expert should decide whether a child should be sent to a medical institution or to parents, to the parents of this child. The state steps in when there is any threat to the public healthcare situation in this region, that is in case of any epidemic, etc. Of course, parents now are very active, and if something will happen, they will find definitely who should be blamed. Andrei Umanets, Internet portal. As far as I understood that your novelties had faced some resistance. Whose resistance? Some of your statements are of recommendational nature. Maybe somebody would disagree with those recommendations and demand some licenses or permits from parents or from the kindergartens. We have compulsory requirements and recommendations. Actually, there could not be any abuses. Our new regulations are designed for the network of private kindergartens. We do not expect any conflict of interest among those kindergartens. I understand that some people who issued that special permits, licenses, certificates in the past, they will feel nostalgia for this, but I do not think that rest of the people will feel negatively about this. So I think that in the future, in case of any problems, we will be able to correct this document and approve it. Am I right when I understand that the main idea of this document is to transfer as much responsibility about the children on the parents and the owners of private kindergartens, not to transfer responsibility because the responsibility already stays with them, but the objective is to remove corruptional component. I would like to add the Ministry of Education pays special attention to quality of preschool education, and the quality of preschool depends on the comfort of children in the kindergartens and conflict-free atmosphere, including the conflict-free atmosphere between staff and parents. and answering your question whether they will take seriously recommendational requirements. We have, as a ministry, we had officially informed about this all the institutions, and now they know what's going on. And I think they are ready to implement this. Of course, there is such thing as a human factor, but in case of any claims from parents, we will respond. Am I correct when I say that it's about kindergartens? As a mother of a child who attends school, would like to extend this trend for schools, because at schools also children are required to submit to provide medical certificates in case of 3-day absence at school. Yeah, speaking with Lilia Mikhailevna Grinevich. Yeah, assigned us, Lilia Mikhailovna, as the minister, assigned us to approach to the Ministry of Health and to develop new sanitary regulations for secondary schools. Olena, as coordinator, would add on this issue. Maybe you have some findings here. The issue here involves also the issue about computer rooms in schools, and we have to study this issue from different point of view. And a small remark. From January 1st, 2017, in Ukraine, all the sanitary regulations issued in the Soviet Union by 1991 will expire, and which requires us to apply new approach in regulations and to decide about the spheres where those regulations should be in place or not. For example, when writing these new regulations for kindergartens, we first studied European experience, and in that slide you saw that in Denmark, Sweden, Iceland, Lithuania, they in general do not regulate sanitary norms, sanitary standards for kindergartens, because in the competitive environment, parents would never take children to the kindergartens with a bad sanitary reputation. Thank you very much, dear colleagues. Thank you for reminding us about this topic. We will happy to see you later when you will inform about application of these new standards. Dear colleagues, if you wish to communicate with the speakers, you may go to the lounge zone while we have next briefing in some minutes. Thank you.